An estimated 1 in 5 Americans will experience a mental health disorder this year. But with proper treatment, a full recovery is possible. That's the message two mental health agencies want to convey, especially to African Americans who traditionally keep mental illness under wraps. The new mental health anti-stigma campaign features former NFL player Dwight Hollier as the spokesperson. Joining me now from one of the campaign partners are Sherry McRill, president and CEO of the Northeast Guidance Center, along with program director Cynthia Jackson. Both you, welcome to American Black Journal.
Thank you.
Thank you.
So this is an issue that I think has something in common with lots of other issues, which is that it is an issue for the general population in this country, dealing with mental illness, mental health disorders, and doing it honestly. It is a bigger problem, a bigger issue when you talk about African Americans. It is a worse problem in that community. Tell me why that's so.
Well, I think that's a problem for our community because there's such a long history of a lack of commitment to mental health. Of course, we think it's something wrong with saying that I have a mental health disorder, and oftentimes, so much of what African Americans are seeing in each other or in their family members who may have mental health disorders, they're experiencing those same symptoms themselves, and of course, I do not want to believe that there's something wrong with me.
There's not something wrong with me. There's not something wrong with my relatives.
Absolutely.
Yeah.
Absolutely.
And so that leads us to this situation where you not only have the problem, but you have a problem identifying and confronting the problem.
Yes. And I think that the new health services campaign, which is educate, encourage, and inspire, is meant just to set out to do that. And although we know in certain, cultures that there is more of a stigma in terms of mental health issues, actually it's also one of those issues that cuts across all socioeconomic categories, all races, all religions. As Cynthia said, it's just something that folks don't like to talk about.
Yeah.
And there's 21 million Americans who are suffering from a severe mental illness, meaning that they have some form of depression, anxiety, bipolar disorder. These are serious illnesses, and we need to bring those out and talk about them and make them seen as are the rest of the medical problems that people might suffer from.
Yeah. How much of this problem do you think is attributable to the I guess, deprioritization of mental health services by government? You think about the state of Michigan, we really handle mental illness and mental health in a way that is very different than the way we used to. A lot less money, a lot fewer institutions involved. Now we turn to the correction system in many ways, and we see these very garish examples of that playing out. How much of that contributes to the stigma, though, of getting mental health help, Cynthia?
Well, I certainly believe that is something that is as much as we would like to not believe that our government does not support, I think that the proof is in the pudding.
Yeah.
It's the dollars, if they don't follow that individual into the community and really are available to provide not just the actual mental health services, but the campaigns that allow us to work around prevention and education of the community. Certainly, it's not perceived as an important issue.
Yeah.
And for us, of course, we know that it is, and it's something that we definitely are going to have to embrace as a community.
Talk to me about the goals of this new campaign. What are the concrete sort of goals that you're shooting for?
Well, moving more towards a positive note, although there has been decreased funding, what I would like to say is, and I've been in mental health a long time, has Cynthia, that there's actually more of a support system and a continuum of care of mental health services available than there ever has before.
Is that right?
I mean, years ago we could hospitalize people, and then we moved to having outpatient services. Today at Northeast Guidance Center alone, we have 22 programs on a continuum of care based on the severity of illness that someone might have, so that they could be in a assertive community treatment program where they're getting care from the medical team in their home. They can be in an intensive outpatient program. They can be getting home-based services, group services, substance abuse disorder services now are, you know, part of the integrated health program in behavioral health care. So in many ways, there are more sophisticated and more services available. Of course, with that comes a need for greater funding. So, you know, it annoys me at times when people say the mental health system is broken. I don't think it's broken. I think it's changed. I think there's a lot more opportunities. It is unfortunate that we have the correction system now providing mental health services to, you know, a high number of folks who are there who could be in other programs. Cynthia runs some programs for us at Northeast Guidance Center that are alternatives to people going to jail. So the whole diversion movement is something very new and very exciting that wasn't here 20, 30 years ago. So we're moving in the right directions. We just need more evidence-based programming and more dollars to support that research.
Yeah. We've only got about a minute left. Tell me again, what are our concrete goals here with this new campaign? What are we hoping to achieve?
Well, again, I think to educate, to encourage, and to inspire our consumers in the mental health system. What we want is for all persons, regardless of their condition, to be able to live a meaningful life independently in the community. That's the same thing that all of us want. We want a home, a stable family life, a job, employment. That's critical for everyone. And so,
and we want people not to be ashamed to say, hey, this is not just me being down, I need help.
And no different than, you know, a pervasive and severe mental illness should be seen no differently as I have diabetes, or I have high blood pressure, I have a mental health disorder, I have a medical condition, and we would like all those things to be, you know, seen as the same continuum of it's a medical condition, we need to accept this, give these people some supports, and move on.
Okay. Well, good luck with the campaign, and
thank you
both for being here.
Thank you very much.
That's our program for today. Thanks for watching. You can get more information about our guests at AmericanBlackJournal.org. As always, you can connect with us on Facebook and on Twitter. Plus, you can also hear our program on WDET 1019 FM. We will see you next time.